My name is Dr. Elizabeth Zhang. I'm from the Health Research Council with American Psychological Association's Division 38, which is the Health Psychology Division. We're here today with Dr. Sonia Suchday, who is a professor of psychology and the chair of psychology at Pace University. She conducts public health research primarily looking at heart disease. So can you tell me a little bit about why a psychologist who's at the American Psychological Association is looking at heart disease?
Well, because heart disease has a lot of there are a lot of factors which are more psychological and social in nature, which makes a person vulnerable to heart disease. And once you do have heart disease, there are some psychological and social factors that can actually either make your disease worse or help you cope better with it.
Mm-hmm. What are some of the most important factors that are psychological in nature that are implicated in heart disease?
Depression is the most common one that strikes me, but in addition to that, it's also things like anger, hostility, stress. Those are the kind of things that make you vulnerable to developing heart disease in the future.
Okay. Now, some of your research broadly in heart disease has looked at something a little bit earlier and more specific, metabolic syndrome.
Mm-hmm.
What does that term mean?
The metabolic syndrome is a collection of preclinical factors, where you're not clinically sick, but there are some parameters that are not quite right.
So I don't have heart disease yet, but there are other things that might suggest that I might develop it in the future?
Exactly.
Okay.
Exactly. So that's what the metabolic syndrome is. It comprises of things like high blood pressure, high triglycerides, elevated levels of LDL, lower levels of HDL, which is the good cholesterol.
Okay, so those are the bad
yes,
cholesterol.
Exactly. Those are the kind of factors that comprise the metabolic syndrome.
Okay. Why is it important to look in the metabolic syndrome and heart disease in general in different people across the globe?
Well, because the risk factors are not the same. They differ amongst different people, and sometimes the same risk factor means something different. Like, for example, if you're looking at the metabolic syndrome amongst Americans, it means a certain thing. It is a certain collection of factors like blood pressure, cholesterol, insulin, which all contribute in a certain way to the development of heart disease. But if you look at those same risk factors in another population, factor A may be more important than factor B. Factor B and C may be related in a different way in that population than it is in the American population. That's why it's important to look at it distinctly in every different population group.
Okay. What are characteristics of different population groups? People in America versus people in India or somewhere else. What are characteristics of those groups that might make those associations different?
There are different factors. Genetics is one obvious factor, but then there are other factors which are only now being understood by the medical community. Things like nutrition, things like your physical environment, also your mother's nutrition when she was pregnant has an impact on how your genetic makeup will develop. In other words, we all have a genetic makeup, but it is environment that determines which aspect of that genetic makeup stands out and contributes pretty significantly to level of risk.
Okay, so not only might my genetics here in the United States be different from somebody's genetics elsewhere, but what I eat may be different, and what my mother ate may be different, and all of that could change the way that pieces of the metabolic syndrome are actually associated with having heart disease.
Exactly. I think what we are trying to do in this field in general is not just say that heart disease, that stress is associated with heart disease or depression is associated with heart disease, but how?
Yeah.
Because unless we know the how of it, what are the mechanistic pathways, what are the nutritional pathways, what are the lifestyle pathways, so to speak, it's very difficult to intervene. how will you change something like that unless and until you're more aware of the specifics of it?
Okay. And it sounds like because those specifics look like they may be different in different countries with different people, the interventions, how we help people avoid heart disease, may be different in different countries.
Well, the interventions would have to be different, not just based on those, on what are the mechanistic pathways and how they interact with each other, but also on the cultural factors, on what is acceptable, what is comfortable to people. Interventions won't work unless and until they're acceptable to people, because we are asking people to do a lot.
Yeah.
We are asking them to change a lifetime of behaving in a particular way, and sometimes even your biology is geared to fight you. Your body gets used to certain things, is craving certain foods, for example, doesn't like exercising if you're not used to it. So your body is also fighting you. So the chances that you will be able to convince people to do something that's good for them are not going to be very high unless you can find a way to put it to them in a way that is comfortable to them. That they understand through their own cultural lens.
Yeah, and it sounds like that their body is ready for it. That
Exactly.
they're ready to actually do.
Exactly.
Okay. So why specifically, we're talking about one study that you did where you were looking at metabolic syndrome in young people in India. Why young people and why India?
Actually, heart disease amongst Indians has been noticed since many years as being different. Okay. One is that it strikes people younger. There is more diffuse disease. In other words, it is more severe.
Okay.
There's multiple factors that are involved with it. They're more likely to die from heart disease. Any cardiologist that treats a lot of Indian patients will automatically tell you that his or her Indian patients are younger. Okay. They have more severe disease. The course of disease is much quicker within that population. So clearly there is something different.
And it's different in a bad way.
It's different in a bad way, and it's also, India is also now becoming the diabetes capital of the world. So heart disease and diabetes are closely interlinked. The metabolic syndrome that you mentioned earlier is risk factors for both heart disease and for diabetes. Okay. So that's why it's critical to look at it within that population in India. Now, my study was done in urban Indians and in Mumbai, which is really a city that symbolizes very, very fast-paced globalization. So as a scientist, going beyond the fact that I'm Indian in terms of my ethnic background and I'm interested, but even as a scientist, it's intriguing because it's a population that allows us to see the impact of globalization on health. Yeah. It's a population that is globalizing at a very fast rate. And it's important to look at it amongst young people because even though heart disease may not show up until you're a little bit older, the damage to your system starts when you're quite young. Okay. So the sooner we can start understanding how these parameters are playing with each other, the easier it may be to help people actually develop the right habits rather than them developing habits and then you're trying to change them to make them more healthy.
And it sounds too like that's why you were studying metabolic syndrome components rather than heart disease itself, that you might be able to see bigger differences in these different components with your young people.
Yes, exactly. Plus the environment, which is such a big contributor, is acting very early. Okay. So it's an opportunity to tease apart the metabolic syndrome and the environment and what is going on.
Okay. So tell me a little bit about what your study found.
Mm-hmm. Well, my study was a very, very preliminary pilot study to look at these factors amongst college students. Now, what we did is factor analyze the data, and what that means is we took the various components of the metabolic syndrome and tried to figure out which parts cluster with each other.
Which parts kind of hang together.
Hang together, and that will maybe provide us a little bit of a glimpse into what might be the physiological pathways by which the disease process is beginning to develop.
Okay.
So for example, in that population, blood pressure was associated with, I believe it was with BMI, and blood pressure was associated with hip-waist ratio, which is, having fat on your gut. And insulin was related to the BMI, which is the body mass index,
Okay.
the amount of fat in your body.
Yeah.
So that is clearly pointing out that even though BMI, like you would assume that body mass index, or basically overall how much fat you carry in your body, as compared to how much fat you carry in your gut, you would
Yeah.
assume that those are the same thing. But clearly this is showing that they are related to different aspects of physiological functioning.
Okay. So it turns out that just looking at how much you weigh isn't as useful as taking into account a lot of different components, including how much fat you're carrying where.
Exactly.
Okay.
Exactly. And those are actually pointing to different pathways by which the disease may develop in your body.
Okay. How do psychological variables play into the metabolic syndrome and risk for heart disease?
Psychological variables actually play pretty significantly. In that particular study, we did not find any linkages between stress and the metabolic syndrome, but we have to remember a lot of the measures that we use for stress and for psychosocial variables are measures that were developed in the West. Now, are they really responsive to how stress is viewed and perceived and experienced in a different culture is a huge question mark.
Okay.
But those are what we have right now, and that's what we have to work with. So, no, they were not related to each other, and the metabolic syndrome and stress in this particular study were not related to each other.
Even though they have been in other studies, but typically in the West.
In the West, they have been, and there have been some preliminary studies in India that are showing the linkages between depression and heart disease, but they are in older samples. Remember, this was a very young sample. Also, it's a protected sample, because even though we did not explicitly have socioeconomic status information, the data was collected from college students at a particularly liberal, well-known institution in South Bombay.
Okay.
So it may have drawn upon a particular, a slightly more affluent sample than you would otherwise assume. So
Sure.
there could be many different factors.
Yeah. So when we want to study psychological factors and their association with health risk, we want to be sure that the measures we're using were at least looked at in the population that we're examining before.
The measures and also the context, because even going beyond population, it's also about socioeconomic status, it is also about families and health habits and lifestyles that will influence how disease is manifested.
Where do you hope to go with this line of research?
Well, hopefully to develop some measures that are more appropriate for that part of the world, and not just that part of the world, but I think in a larger sense, try to understand how do you study some of these factors in different cultures. So on the one hand, yes, I would love to find out more about India, because that's where a lot of my research has been concentrated. But beyond that, even to understand how do you look at different cultures in different parts of the world and tease apart some of these things. And going beyond that, can we find things that are universally stressful everywhere? Because that would be a simpler message that can be heard by everybody.
Yeah.
So.
All right. Thank you so much, Dr. Suchday, for your
you.
time. And thank you for watching this conversation with Dr. Sonia Suchday about cardiac risk factors and psychological factors in India. It's been great for you to be able to hear a little bit about the research being done by psychologists through the American Psychological Association's Division 38 for Health Psychology.